Oh, good. And as began, we started talking together a long time ago about, gee, the experiences that many people are having in putting together oral systemic programs in their office, and how we could make that better, what we should do to make it better. And that's how we eventually evolved into having the program that we currently have as advanced dental medicine. We wanted to create a bridge between medicine and dentistry. My background in both working in both medicine and dentistry, and Steve's background in working in almost every phase of dentistry, really creates a great bridge to bring all the medical concepts, all the dental practice concepts, and the implementation concepts together. And so that's what advanced dental medicine is, and why we're involved in the industry. We have a very deep love and passion for bringing about health and having dentistry take up a different role, a bigger role, and a role that is more involved in our patients' lives. So that's where we came from. Now, in that, we were talking just a little bit ago about the AOSH convention and how we really enjoyed everything that we saw there, that the information was good to have, and where do you go to get that kind of information? I mean, to get that quality of speakers, to really bring the cutting edge information was wonderful for us to hear. And it really got us to thinking about, well, how can we extend that beyond, and how do we answer the questions that Steve heard, I heard, all of us heard at the meeting was, well, okay, where do we go now? And so talking to folks like Paula, who have been out there and doing this for a number of years, is really exciting because they've had the experience, they know it can be done, and there are lots of different ways to do it. Well, I'd like to have Steve tell us a little bit about what he's found out over the past 9 years, or well, it's now 10 years, 10 years of working in this area and hundreds of offices and implementations. What really gets you to that next step, Steve? Can you help us understand that?
Sure. Yes, like Dr. Verity said, I've been at it for almost 10 years now. And so what I would like to do is kind of talk to you about what I have found over the last 9.5 years, what seems to be successful in dental practices, and what can we do to kind of answer the questions of what do we do now, or how do we put together an oral systemic program in a practice. I think a lot of offices have gotten a piece here and a piece there and have kind of created something, but I want to talk about those parts of an oral systemic practice or system, what parts of that system are important to have in every practice to have a successful oral systemic program that we've garnered over the years. First of all, I want to put that into 3 stages. The 3 stages that I find to be important is education and evaluation. Before we go and implement any kind of oral systemic program into an office, we would first like to evaluate the office to make sure that kind of the concept, or if there is a buy-in in the office, or if there is certain kinds of problems that need to be taken care of so that they can have a successful program. And then it's very important to make sure that the whole office really understands the oral systemic science and some of the concepts in the oral systemic connection so that they will have a successful program. And we find that that's very, very important to get buy-in all across. And that's part of that team preparation, is we have a series of educational courses that get the whole office on board for an oral systemic program. We found that when we go in and implement without that preparation, that sometimes a dentist goes to a meeting and gets excited and then comes back and tries to implement something in the office, and there's no buy-in from the hygiene department or from the front office, or there's somebody sabotaging it all along the way. And I think that we've all either seen or been in dental practices where we see those kinds of things happening. And so I've seen that happen over and over again. So I think it's important to really prepare the whole office. Okay, go to the next slide here. Okay, so again, we're shifting to a wellness model, and sometimes that takes a long time. And so what we try to do is we want to shorten the amount of time that it takes to implement that wellness model into a practice. It is a paradigm shift, and sometimes it is a very difficult paradigm shift for certain offices to actually implement. Now, why a system? I think a system is so important. I think you can go out there and kind of create your own system, but if a system that is tried, true, and tested, that it works, is very important for an office who's kind of looking and trying to figure out how to put it together. For someone to come in who's done it, who's seen it done in other practices, comes in and consults that office and helps them to set that system up, and with the verbiage, all the things, all the parts and pieces of the puzzle. Learn how to create that sales funnel. Now, there's a lot of consultants out there that talk about that, but we get into that, and how do we get patients into that funnel? There again, we already talked about evaluation. I don't need to go into too much more detail about that, but it's very, very important to ask questions, to find out where the office is now and how much is needed to be able to help that office move into an oral systemic wellness module. Okay, these are the 6 steps that I want to talk about now. Very important steps that I have found over the last 9.5 years are very, very important for an office to be successful. First of all, we do it with online education, okay? That's very important. We can't go to every office and educate them. So we do it online. We can do several offices at a time, or we can do one office at a time. We offer CE credit. If you're going to be learning about this, why not be able to get some CE credit, continuing education credit, as the whole office is learning? We wanted to create a modular video series, because what happened is, whenever we would go in and implement an oral systemic program into a dental office, they would have turnover. And so every time there was a new person coming in, we were having to sometimes go in and retrain them to get their buy-in into the whole thing that's going on in the practice. So that's very important. Coaching and support, yes.
I want to emphasize that they didn't have the employee turnover because of the video series. That was a joke.
Right.
Okay,
yes.
Never mind.
Absolutely. Now,
throw me a bone.
Exactly. Coaching and support is so important. If you're going to implement an oral systemic program, you're going to run into obstacles. If I taught you everything I knew, when you go to your office, it's different. And sometimes things come up that are obstacles that are difficult for you to overcome. That's why it's important to have people who have experience, who have put up with this, or getting information from other offices who have been through the same thing. And that support and coaching, in my opinion, needs to be ongoing forever. We become one of your team members to make sure you're successful in implementing that oral systemic program. Okay, team logistics. We want to talk about team incentives. The worst thing that a dentist can do is go and say, I want to implement an oral systemic program. That automatically puts an income stream that's more focused on the hygiene department than it is on any other department in the office. So if they start an oral systemic program that puts more work on the hygienist, and they don't get any kind of team incentives, it creates a problem. So it's very important to have team incentives in there, especially for the hygiene department and everybody else in the office. It's important for everybody in the office to understand their role and responsibilities in that oral systemic program. And we create those roles inside the office so everybody knows what their role is. It's important in the morning huddle to change things a little bit and talk about those patients that you're going to be presenting an oral systemic program to. It's also important to bring those patients up in your staff meetings and any problems that you're having, so we can help overcome any obstacles or problems you're having. Okay. Step 2 is we teach you some very, very important principles and concepts that help to create a successful program. We want to teach you that failure is not an option. You have to have buy-in, and you have to not give up when things get tough. Failure is not an option. We all know how important the problem of periodontal disease and how that is linked to all these other diseases in the body. So failure is not an option. Complete treatment plans, knowing what where to put in all the testing and the assessments in, along with your perio program, your scaling and route planning, how that all fits in together the best way. Okay? And it's also important to have those treatment plans classified, because we're going to put people in 3 different kinds of classes, so that the people in class 1 are going to have a shorter program, the people in class 2 are going to have a little longer, and the people in class 3 are going to have a longer program that they stay in. And we tell you why that's important. There are 3 steps of that process. We want to pre-frame that patient before they come into the office, in the waiting room. Co-discovery is so important for that patient to get buy-in, to understand and to buy into what's wrong with their own health, and then to present that to the patient in a way that they are willing to move forward. Offices struggle with that, and we want to make that easier for you to make sure you have a successful oral systemic program in your office. Understanding the patient communication, how we communicate to the patient, how we talk to them about the oral systemic, is so important, and we've got years of experience on how to move that patient along. Flexible payment plans are so important, so that everybody has the opportunity to participate. Okay? And when I talk about an orthodontic model, that's a very, very important concept. It's important for you to understand that if you just have 1 product or 2 products and you try to sell that, it's much more difficult to do than if you have a program that's very comprehensive, everything is included in that program, and you have a monthly payment that patient can pay, instead of picking and choosing, can I do that and not do this. It's really important to have an all-together comprehensive program, and then let the patient pay a small monthly payment, and then everything is paid for in the treatment.
You know, Steve, I think what's really critical about what you're saying here is that over the past 10 years, you know, we've all tried different things, but you've tried all these things in the various offices, and one office isn't always the same as the other. So what you're describing is an overview of a tailored and a program that's really made to fit for an office, so that they don't have to become something totally brand new and different than what they are, that they get to be who they are, but this is a way to implement this in each of their offices rather than a one-size-fits-all type of an approach.
Exactly. The important thing about an oral systemic program is that you're doing the right thing, but it's also important that it is a profitable venture. There's no reason to put something in that you're going to work harder at unless it's profitable for your office. And I will guarantee you that if you do this correctly, this can become very profitable in your practice. Now, what, how, and when? And you'll notice that I listed all the different kinds of assessments or tests that we can do inside of a dental practice. Some of you are aware of them. Some of you already do them in your practice. Some of you have heard of Plaque 2. Some of you have heard of the pathogen test, or oral DNA, or Hain Diagnostics, or Silverstaff. They have the pathogen test. Some of you may not have heard of Bannett's test, but that is a very, very important test, and it's very, very important for that co-discovery part of the process. And then all of us, HSCRP and HbA1c, if you know what those are, and I think you've all heard of those if you went to the AOSH meeting, are very, very important to help the patient understand where their health now and whether or not their periodontal disease has gone systemic. And I can't emphasize enough how important that is for them, to help them understand that it has possibly gone systemic, and that's why it's so important to take care of it. Now, the perio assessment is also important, and there's certain things that are very important in that perio assessment that have to be there to make it successful. And all of us know how to do a perio assessment, but there's some things that make it more successful so that you can sell more. You all know that 50% to 75% of the patients that come through your hygiene department have some level of perio going on, and there should be a lot more perio programs being sold in dental practices than there are now. Classification, yes.
Yeah, Steve, you make a really good point here, and I think it's easy to miss this one. Having worked in the insurance industry as a consultant, as I have for a number of years, I can tell you that it's really interesting to look at the claims that come through. And what we see is that there's a small number of patients being treated for periodontal disease, class 2, 3, and so forth, compared to what we know is out there. And this is what we find very interesting, is why is this not being done? One of the things that we know happens from working in dental offices and running my own offices is that there's a lot of bloody prophies that get done, and if you're not in there saying, wait a minute, we don't have to do this, there's a better way to do this, we can actually treat our patients better by doing this, then I think offices begin to realize, well, wait, we don't have to do a bloody prophy. We can help the patient get beyond that so that they don't have to keep doing that. So,
very good. Moving on, the classification of disease, we've already talked about that, the class 1, class 2, class 3. We get more into that. And Canberra is also the carry-free program. We're going to discuss that. We discussed that in step 3 and how that can fit into a practice. Along with what's very important is the family medical history, not just the patient medical history, but an augmented patient history that opens up the door and the discussion for the oral systemic health connection. That's very important to augment the medical history you may have in the office now. And we talk about how to do that. We also talk about step 4, we talk about the actual treatment protocols. Why it is important to use possibly a probe that helps you to help the patient co-discover that there's something going on. We use a tray therapy along with our nano silver gel that Dr. Verdi's going to talk more about. And we also help you learn about how lasers can be very effective in your So like Dr. Verdi said before, you don't need everything. What we do is find out what you already have, give you all the options, and then you're able to make a good qualified decision on what you would like inside of your practice in your oral systemic system or program.
One of the things that we recognized, Steve, as we were working with the various offices around the country was that different states have different allowances or requirements that hygienists can do. As an example, we all know that in certain states, the hygienists are not allowed to use a laser, and the dentist has to come in and do that. So when we developed a program, we wanted to figure out how, look, what works for everybody regardless of what they're doing. And here are the things that we know people are doing. They're doing scaling and root planing all the time. And that is the traditional approach to dealing with this problem. But everyone in this webinar realizes that, well, okay, that's old technology. You can't kill very many bacteria with a curette. It's just hard to chase them down. And so there needs to be a different approach that gets the job done. Certainly the debridement is valuable and very essential in order to get a long-lasting result. Well, as I was working in medicine in the hospital, came across burns that were being treated, and I actually came across a company early on that had developed an FDA-approved product. And this product was being used in the hospitals for burns and wounds. And these were not, I'm not talking the simple burns or the simple wounds. These are huge decubitus wounds. That's a big ulcerative wound that actually goes down into the muscle tissue and other layers. And they're very difficult to fix and to resolve. Well, they put this gel on it, and it got rid of all the infection, and it got rid of all the bad granulation tissue that didn't have good vascularization, and suddenly these things started to heal up and looked incredibly good very fast. Oh, shoot. I'm sorry, did we lose the connection? I can't tell. Oh, okay, good. My headset just went real quiet, so I apologize. So anyway, there I was in the hospital looking at this, thing, and I said, well, wow, let me help distribute that and get that into various places where it could do some good. And in the process, I realized that, well, wait a minute, these wounds are very similar to a periodontal wound, and wouldn't this be great to use in them if we could? And so we began to investigate that, and sure enough, the results were, well, in my opinion, they were spectacular. And the results that we've been getting are spectacular, and so we wanted to share that with people. So what we've done is we've created a product. Now, P3 is a product that can be used in an oral tray. You'll notice to the left, to the right, there's a model or an example of a tray, and it's different than the PerioProtect tray, and it's different than a bleaching tray, which you might be familiar or accustomed to seeing. Now, those doctors who use PerioProtect, and we have a lot of offices who use PerioProtect who are now using or beginning to use the P3 product because of the advantages it has. There's nothing wrong with hydrogen peroxide. It has many wonderful side effects and advantages to it. In fact, when we first started making P3, we made it with hydrogen peroxide in it. We still have that and can produce that, but we find it's just not necessary. And the biggest difference we find is that the hydrogen peroxide, what we liked about it, would cause a little bit of bleaching on the teeth so they go white, and the patients liked that. But as far as actually getting in and doing the actual destruction of the pathogens, the P3 gel alone was more than sufficient. So we developed this gel into a tray material to be used in either a PerioProtect tray, which you would order through the PerioProtect system, and if you're certified in that system, certainly this material works in those trays. And we mentioned at the seminar that Dr. Keller is also investigating this for use in their trays for a variety of ways. The other thing that we noticed was that we wanted to put something else in it besides this molecule, this special molecule that I'm going to have Jean talk to us about in just a second. You know, what is this? Why does it do what it does? And you know, so forth. But we also put xylitol in this preparation. We know that even though the P3 absolutely kills the bugs that cause tooth decay, putting the xylitol in it has another effect that is very helpful in the maintenance of good health along the tissue. What we've talked about the fact that this antimicrobial gel will kill pathogens. In fact, we've not found a pathogen it will not kill. It kills every pathogen that they've tried it against. We're currently doing a protocol study to show that it kills the specific pathogens that we're trying to hit in a periodontal pocket. But it doesn't kill all of the probiotics. We find that it's very kind to the probiotic environment. It will eliminate maybe 30% in the beginning, but those 30% rebound very quickly because now the pathogens are out of the way and they assume a normal biotic concentration within a day. So we find that this is a very valuable thing to have, is this biofilm in place. It will not destroy the biofilm, and it will not destroy the pathogen, or pardon me, the probiotic bacteria that are necessary in the mouth. So before I go much further, Jean, would you mind taking a minute and telling us a little bit about this molecule and why it does what it does and so forth? Are you there, Jean? Oh, well, maybe I'll tell you. Oh, there you are.
No, I'm sorry. I was going to ask Steve to pass the screen over to me, and I can show them a couple of things. And here it comes. Just let me know when it comes up for everyone.
Okay, I see it.
Okay. Get on the slideshow from the beginning. Well, there's our logo again. This is the molecular structure of what David was just, Dr. Verity was just talking about. And this was come upon as not an experiment, but a company was trying to make a better variety of colloidal silver. The medical community has used colloidal silver for, well, decades in a very rigid protocol, but for centuries and centuries silver has been used for its microbial activity. But what they came up with in doing it in the patented way that they do was a structure that formed a tetrahedron. And as you can see on the lower left, there's a circle with the pyramidal structure in it, which is the tetrahedron of 4 silver molecules, which bind with 4 oxygen molecules, making this basically something that oxygenates. And the kill structure here is very interesting because with an ionic silver, which I would imagine everybody here on this phone call knows about, there is one molecule on the shell of a silver particle, and it wants to match up with, and so it goes and steals from a pathogen an electron. And now that it is bound to that electron, it's done. It can't do anything more. It's inactivated. Therefore, it takes multi-millions of those ionic silver particles to get into a wound structure, whether it's perio or anywhere else on the body, to kill all the billions of pathogens that are in a wound. Well, this structure here, this tetrahedral structure, first off, you're starting with 4 molecules. But secondly, if you see the particle to the right, there are thousands of these molecules on the outside of that particle, not just one, thousands. And each of those thousands of particles have those 4 silver molecules within it. And it never binds. So it can kill from a distance, and it has a resonance in it about the same as UV light, 890 to 900, to 910 hertz, and so it kills from a distance. It has several ways in which it kills pathogens. But the fact that it never binds means that it's working 24/7, which also means that you don't need the high parts per million. So the FDA has approved this because it has no toxicity. The ingestion has showed that it does not bind in the body. It all is processed through the kidneys and comes out in the urine. And it has no mutagenicity as well. So that's why the FDA said, yes, this is a bactericide.
Gina, may I interject for just a second? One of the things that I find so fascinating about this is when we look at the FDA studies and their approval process, they classify this as a device. And one of the reasons that they classify it as a device as opposed to a drug is that, unlike a drug, this molecule goes into the body, does its work, and comes out in the exact same form. So in other words, they look at this as there is no chemical change to this structure, therefore it must be a machine that then goes through the body and comes out without changing. In truth, they realize it's a catalyst, but the way they classify it is as a device. So it's a catalytic device, and it's the first true nanotech, biotic. And
as Dr. Verity mentioned, it's been tested on over 300 microorganisms, really tough stuff like MRSA, VRE, Pseudomonas, and it kills it immediately. I'm going to get to the kill time study slide in just a couple, but I'll go to this next one. And he already mentioned that it leaves at least 70% of the probiotics fully functioning. Okay, so the basis for our new material is this, and it's a tetrananobiotic, is what we refer to it as. And this is a very confusing slide with lots of numbers on it, but basically all it means is this has an effect on both gram-negative and the tougher gram-positive bacteria. And yet we need no more than 5 parts per million necessary for a full kill. And this is a comparison table of all the antibiotics across the top, which have a lot of effects on the body that are to the negative. We have no negative effects on the body. And it takes very, very few parts per million. The first numbers before the slash is the parts per million that it would take in order to stop the bacteria from growing further on the petri dish or on the agar plate. The second after the slash is what it takes to totally kill them off. So here's the stop, and here's the kill numbers. And as you can see, very, very low parts per million. And over on the left side, I don't know if Dr. Verity wants to. Pathogens on the left side. But would you like to say anything about those in particular or why they were put on this chart?
Yeah, I'm sorry, Gina, I got muted for a moment, so I wasn't quite sure. But I think what you're asking me is the bacteria that are listed on the left-hand side. Why is there any significance to the ones they chose? And of course there are. Some of those are bacteria of particular interest to medicine. You'll see the Staph aureus is obviously a very important one to them. There's a lot of infections they deal with that. But you'll notice others. Of course, you see strep mutans on there. That's Staph mutans causes dental caries. But you might not notice things like Gordonii and this particular Pseudomonas. These are bacteria that are specifically kept and used in testing because they are difficult to kill and they represent a class or a type of pathogen that if you know you kill that one, then you kill all these other bacteria that are in that same class. And so they use those as indicators. Okay, so what does that mean to us as dentists? It means that, from my point of view as a researcher, it means that the bacteria we want to kill, you know, the 6 bacteria that cause all our periodontal problems, or the ones we're identifying presently, are they going to be killed by this stuff? And this study says yes, they are. What we're about doing right now is demonstrating specifically with those pathogens, okay, we thought they would, and here's how much they kill, and here's how long it takes. So that's why I want to mention these pathogens on the left-hand side are representative of pathogens that you would be familiar with were they to be used. They just fall under these categories.
Okay, great, thank you. This is the kill time study that was done with only 32 parts per million. So you know how very low that is in a silver concentration. But remember, because there are thousands of molecules on the outside of each nanoparticle of silver, you've got a lot of power behind this. The FDA standards to name something a bactericide is that a bacteria log reduction requirements is 1 full log within 7 days, and then 3 full logs within the next 14 days, and then no increase for the next 14 days, meaning a 28-day trial period. So our kill time study, we did an exposure interval at 1 hour and 24 hours of some real nasty ones. Over on the left, there's MRSA, there's Pseudomonas aeruginosa, and VRE. And the control titer were auger plates, and it was about 2 million pathogens or bacteria per milliliter. And so that's a very heavy concentration. It was a real jaw-dropper for everybody. And the log reduction was 5 within an hour. Not 7 days for 1 log, but 5 in only 1 hour. And as you can see, in a 24-hour period, it stays wiped out. VRE was just a little bit tougher. We only got 2.35 logs in an hour, which is still outstanding instead of 1 log in 7 days, because it's a very, very stubborn one. But within the 24-hour period, everything was gone.
So this is really interesting, because they say, Gene, they say here 3 logs in 14 days, and what you're telling us by this slide is that within an hour, 5 or more logs were done.
Yeah.
Right.
Right.
So which exceeds the standard of the 14 days, and of course maintained it for that
yes.
long. But so wow,
yes, it did.
That's why the medical community is so jazzed about this particular stuff.
Right. Okay, and this is the basis for the product line with which we are coming out.
Mm-hmm.
And so I'll go to the next slide, and David, there it is, the product line.
All right. Okay, so I don't want to spend a ton of time here, Gene. I just wanted to introduce the product. Okay. All 3 of these products have the tetrananobiotic material in it. Of course, the gel has purely that, and we've added some other things like the xylitol to get some enhancements that we wanted. None of these products have any alcohol, sulfa, or alginates. And so why do we mention that? Well, of course, we know why we don't want to have alcohol. The sulfa is pretty obvious for those of us who have read up on what effects do the sulfa have in our patients. The alginates might confuse dentists. That's really one that is important to medicine. A lot of the other preparations that they put in these burns will have an alginate in it. And what happens is that makes it sticky and gooey. And it's not a dissolvable gel as the hydrogel is, which is what we use. The alginate gels are, well, it's like if you have a really, really thin mix of alginate and it gets all slimy. And that's what it's like on the burn, and they don't like that. So this does not have that, and it makes a difference for the way we use it in dentistry. So this is a brand new generation of a nanotechnology form of antimicrobial control. And it is the first one. You will see maybe the word nanotech out there. What they're usually referring to is an ion, which, okay, it is an ion. If any ionic form is going to be small, even silver is in the nano frame. But what we're really talking about in nanotechnology is it's a organization of molecules that creates and does a very specific function in a catalytic or a non-depleting event. And so that's what we have. So anyway, that's the product line that we're introducing. And Steve, I'd like you to pick it back up if you would.
Okay.
Do you want me to go to that one?
Okay. Both David and Jean just ended up talking about the P3 products. This is step 5. In step 5, we're talking about home care. I'm going to talk about home care first because I believe that home care program in a successful oral systemic program is vital. Okay? If we're going to clean up the perio, and we're not doing something like keeping them on a perio protect tray forever or something to keep the perio away, it's going to come back. So if that's why our home care products were designed to be able to be after we've done the laser therapy or we've done our tray therapy every single day, the patient at home is doing something along with their brushing their teeth and rinsing with an oral rinse that neutralizes the pH in the mouth, really helps along with oral irrigation and nutritionals. So we find that home care products are very, very important. What I think is important about our home care products is you don't have to stockpile any of these products in your office. Once the patient gets on these home care products, we take care of getting them to the patient on time, and then you get a percentage of that profit from all those home care products, which makes it very nice for you in the dental office, so you don't have to stockpile products in your storage room.
Hey, Steve.
Yeah.
I want to jump in here for just a second. We were talking earlier with Paula, who is at Perio Protect office, and we were talking about, well, you know, and she made a really interesting comment that I'd like to repeat. I hope you don't mind, Paul. I want to share with the rest of us the comment you made, which was, you know, you only have to keep using this if you want to stay healthy. And you're right. It's kind of like our old refrain when we would tell patients, well, you only have to floss the teeth you want to keep, right? Well, in this situation, because we understand the greater effect that the periodontal bacteria have on the system, it becomes now important to realize that, you know, gee, you might not have a lot of symptoms, but you might have this invasion of bacteria into the bloodstream. So when we developed this product, what we're really excited about is you don't have to keep your patient on a therapy program for the rest of their life. By converting to these products, they can very easily keep the disease away over the long period of time. And then, of course, if for some reason they slack off or it comes back, there's yet another therapy to get them back into compliance and back into health and wellness, which is where we really want to keep them, is in wellness, in a system that they're familiar with and can do duplicatively and reproducibly. Yeah. So that's why we really like this home care system.
Now, in our treatment presentation, when we're selling this treatment to the patient, it's very important to take all the tests, all the assessments we've done, and have what we call a review of findings with that patient so that they're able to accept and understand where they are in their health. And it makes it very simple for them to move forward into treatment. Okay, the next step, in fact, physician referrals. Dr. Lee Osler, who is now the president of AOSH, told me years ago when I was helping to train his office, he said, we started talking about physician referrals. He said, Steve, that's the holy grail of the whole oral systemic experience. If we can get to the point where we're getting referrals from physicians, we really feel like that is the final step in the oral systemic progression of where we really should be. So that's a very, very important step to learn how to do that, what to do and how to do it, and how to create those relationships. And there's a lot of different ways that we teach you how to do that. Now, what happens when we've been having a successful program in our practice? We can start to move into a wellness coaching, because now that the patients have kind of gotten rid of their periodontal disease and they're getting better, now we can start to move into a true wellness concept, and that opens up some whole other doors that assessments that we can do in dental offices that are medical type tests, but they can be done in dental offices. Let me draw your attention to one that I think is one of the most important and successful ones, and that is thermography. If you look down at the lower right-hand corner, you see a thermograph. Now, if you look at their mouth, you'll see anywhere that there's red areas is inflammation. Anywhere there's blue or purple areas, that's a cool area, but any of the red places are inflammatory. So look to see, where do you see any kind of redness in the mouth? See on the left-hand side of the patient, can you see that red there? That patient has got inflammation in the mouth. He has periodontal disease going on there, and you can see that in this thermogram. If you look up next to where the nose is, you can see how the inflammation in the sinuses are. And you can. This is a very easy and simple way to kind of see that. Yes. Yeah.
Use your pen to show those, because it might be, I mean, they may not know what you're talking about.
Yeah, let me do that. If we come down here, see right here. See where that redness is there?
Mm-hmm.
Okay.
And
that shows that there's something going on either in the teeth or in the gums. Okay, and that's so you don't see any of that on this side, but you see some periodontal problems going on over here on this side. And you see the inflammation here in the neck area. So with thermography, you can see a disease process. You can see cancer in the breast and other places in the body that are starting a lot sooner than you can see it with a mammogram. So thermography can be a great resource in a wellness center. What happens if we take a patient through our program and then we redo the CRP after we've taken care of the periodontal disease, and we do the CRP test again and we still see it's high? That's when we go into here and we start going further with zytotechnology or thermography, and then start referring this information over to the medical doctor so that we can start looking further to what might be going on in their body. And we found people who have had cancer or diabetes that didn't know they had it after we got rid of the periodontal disease.
So these screening tests and these tests that you're talking about, Steve, really help the dentist create a communication path with the physician, and it now becomes a two-way street where you've got something to share with the physician about a common patient, and that's a lot easier way to open up a conversation. Is that what you're trying to point out?
That's exactly right. That leads right into that better conversation with the physician. And our goal is to create an integrated practitioner team, possibly with a chiropractor or a naturopathic doctor or a medical doctor. We find that to be very important, that then we can be referring to other people, other practitioners that can help that patient find out what else is going on inside their body. So now you become a true integrated practitioner team. And that's what we're trying to accomplish. Okay, so the final step after those 6 steps is actually implementing it into the practice. Let's see here. Hold on for a second. Let me get rid of that pen. Okay. There we go. Okay, so that can be done in office or online. And so I think that's important. There's different, sometimes it's difficult to go to the office. It may be expensive, but there's ways to do trainings online or in office. So that's that final step of the implementation. And we find that those 6 steps are very important for a successful implementation in a dental practice. And this is what I've learned over the last 9.5 years. So, where do we go from here? And what have we talked about tonight? And I'll just go through these, and then Dr. Verity can go into a little bit more detail about some of these. But I think the first step that you want to take today, if you want to do something a little more than what you're doing in your office than you're doing now, join our pilot program where you're going to be able to get some of that nanobiotic gel, and you can be part of our study program to show the efficacy of that. Or join the study club where we'll have ongoing information and ongoing learning that will be brought to you through every month about the oral systemic health connection. And then when you're ready, take those 6 steps of successful implementation so that you can have a successful, profitable, comprehensive program in your dental practice.
Steve, would this be a good time to talk about the pilot program and that study club a little bit further? Do we have a minute?
Yes.
I'd like to talk about that a little bit because this is something that I think is really needed, and is really a very good and easy way for practitioners to get involved in this if they've not before. It's also a great place for people who have been involved in the oral systemic health connection for some time, like PeriProtect offices. What we're doing is we know this product kills the bacteria. We've seen it work in vitro. That means in a petri dish or in a test tube or in a chamber of some sort. But what we want to demonstrate is what we've seen clinically and what I have personally seen in my own work with patients is that it does kill this bacteria, but I want to demonstrate it. So this pilot study is being conducted with 50 patients, and we're getting a small number of dentists to manage and be evaluators during this pilot study to put it's a very specific application. It's not treating full periodontal disease. It's demonstrating that the bacteria are being killed in what period of time. So it kind of goes along with that study Gene was showing you, but it's a little different because it's an in vivo study, meaning it's in the mouth. And so that anyone who is on this call and would like to know more about that and become involved in the pilot program, it's very easy to do, and you just have to let us know. And then what we decided at AOSH was, there's so many great speakers, and we've talked to, I really don't know, probably at least half of all of the doctors that attended AOSH, and to a person they all said, man, this is such great information. I felt like I'm trying to drink from a fire hydrant instead of a water fountain. It's a deluge, it's a rush of information to try and absorb very quickly. So what we wanted to do was create a study club where you could deal with these topics with the same quality and kind of speaker. In fact, the very same speakers that we heard at AOSH coming to our study club and talking to us about their work, helping us to stay at the very leading edge of what is happening in research, the new connections that are being made, and also how do you put this all together in your practice. So lots of different speakers who've done it, who are doing it, and who have success information to share with us. And you can join, each of you are invited to join the study club. Again, just we'll give you an email to drop us a line at or to get a hold of us. Just let us know and we'll get you on that study club. It's a fantastic way, in my estimation, of staying abreast of what's going on. It's kind of like going to AOSH once a month instead of trying to take it all at once. And then you can go to AOSH and meet all your friends and talk about all the wonderful things they're doing in their practices as well. So it's kind of like a monthly AOSH club, if you want to think of it that way.
Dr. Verity, let me just add something to that. Now, the 6 steps to a successful implementation is a 6 educational program, which could take anywhere from about 6 weeks of every week doing an hour to 2 program to really get the office ready for a successful implementation. Now, that doesn't mean that you have to be a part of that 6 steps to participate in the pilot program and vice versa. If you start doing the 6 steps during the pilot program, absolutely, that's a wonderful way to be ready. We are going to start those educational programs starting November 1st, and that gives us about 6 weeks to get you ready to implementation when our home care products are going to be rolled out and hit the market. So if you're ready to get started now in the 6 steps, by the time we're finished, not only will you be already part of the pilot program, but you will be ready for the rollout of our new home care products that will have the nanobiotic technology in it.
Right. Okay, well, this is that slide we were talking about earlier. I wanted to let you know, look, a lot of you are going to want to do something. And no matter what you do, become involved and learn more about this, because I cannot stress what I'm seeing from my perspective at doing some really interesting work with hospitals and other physicians and doctors and dentists and how we're working together. It all begins with doing something. And so what we're trying to do is say there are a lot of ways to get involved. We've tried to make it very convenient and easy. So all you have to do is drop us a line. The address is on the top of this sheet. It's info@p3adm.com. In the alternate, you can give us a call at our phone number, 888-421-0609. And again, you're all invited to let us know which of those you'd like to work with, and we encourage you to join them all. Also, if you'd like to visit our website, go to p3adm.com, and you can poke around there and kind of find out more information if you like. And don't hesitate to call us and let us know what you think or what you'd like to hear more about. So that's the actual commercial plug for the evening. So hope you've enjoyed our information and presentation. We feel very passionate about what we're doing in this endeavor of dentistry, and I feel particularly fortunate to be involved in it, and I hope you all do as well. Thank you for joining us tonight.
Dr. Verity, what if they have any questions? What
they can also drop us a line there. They can maybe ask us now if we've got a few more minutes. I think we've got about 5 more minutes. We could answer a few of those questions, but surely any question that you don't get out now, please send it to us there at info@p3adm.com, and we will get back with you and answer that. Or you could also give us a call, although it's more difficult to get to someone who's going to answer your question right away through the phone, but that's also another outlet.
And also, I'm going to be, this is Jean, and I'm going to be sending out an email thanking you and perhaps giving you a little bit more information, a detail about the study club or something like that. So please expect that, and if we're going to your spam box and you've discovered us there, then put us into your inbox as far as an address goes, and then we can get to the right place more easily.
That's right. Thank you. All right. Are there any questions that anyone would like to ask before we close the webinar tonight? Going once, going twice. Better speak up because Steve's got his hand right on that button.
Let me make sure. Is everybody there, or is everybody muted?
Oh yeah, make sure they're not muted. That's a good idea.
Let's see here.
Wow. Didn't know you muted people. Didn't know you muted people. I thought maybe you muted me, but I didn't know you muted everybody. I thought maybe you muted me, but I didn't know you muted everybody.
I want to make sure that is there anybody there now that has a question?
Would anybody like to put forth any questions?
No.
I think that's it.
I do too. Well, I'm glad that we had as many participants